Well, big changes are in store for Medicaid, the joint federal and state program that helps cover medical costs for people with limited income and resources. However, the One Big Beautiful Bill recently signed into law by President Trump could impact the lives of many Americans living with disabilities. WENY Washington correspondent Brendan Scanlon spoke with some advocates and joined us live with more this evening. Brendan.
Hey there, Renata. Good evening. Yeah, it was branded as a One Big Beautiful Bill, but for Americans living with disabilities and advocates I spoke with, they say it could be absolutely catastrophic for the services many of them rely on.
The passage of this bill is concerning. It's scary to the disability community.
Shauna Eakin leads Voices for Independence in Erie, Pennsylvania, an organization that helps people with disabilities live independently. She relies on those same home care services herself.
But without my home care worker, I couldn't do my job. She comes in every morning, gets me up, gets me dressed, gets me ready for my work day.
But close to $1 trillion in federal Medicaid cuts, including a new requirement for states to pay more of the bill, could impact home and community-based services.
When states have to bear a bigger share of that cost, that means there's going to be fewer services.
The federal matching funds that come to Pennsylvania will be reduced. By what percentage, we don't know.
The vital services could be on the chopping block as states like Eakin's try to do more with less.
And those hard choices are going to involve looking at what they can afford to pay for and what they can't.
She says in Pennsylvania, home and community-based services are considered optional, unlike nursing home care, the only long-term service and support Medicaid is required to cover.
It's less costly to be at home. You can serve on average 3 people for the cost of 1 nursing home bed.
In order for the benefits to stay stable, we've got to eliminate the waste, fraud, and abuse. Benefits will be consistent. The way we operate, our overall operation, has been slimmed down and become more efficient, more effective.
Eakin says it's not a partisan issue, it's personal.
We're talking about real people with real lives. If everything happens the way that we think it will, it's going to be catastrophic.
And Renata, many of these changes are expected to begin later next year, but keep in mind that they're going to vary state by state. What happens in Pennsylvania might not be the same case that happens in New York. So there's a lot of uncertainty, especially among advocates I was speaking with. They say that they're going to be watching state lawmakers and state policymakers very closely to see how they handle those important funding decisions with less money coming from the federal government. Reporting live on Capitol Hill for WENY News, I'm Brendan Scanlon. Renata, back to you.